What's going on, everybody? In this video, we are talking about the pandemic, the coronavirus pandemic. Specifically, we're going to talk about what the virus is and what special precautions us bearded men need to take. And also, did the CDC recommend that we shave our beards? We're going to talk about all that. My name is Nick Carnese. I'm a former U.S. Marine and the founder of Stubble and Stash. And before we dive into it, everything I'm about to share with you comes directly from the Centers for Disease Control, the World Health Organization, and from conversations I've had with a number of doctors here in the Washington, D.C. area. I have links in the description below going directly to the CDC and the WHO. It's important if you have concerns about the coronavirus, take advice directly from your healthcare provider or from those two organizations. They're the experts. There's a lot of stuff floating around on social media and this and that, and there's a lot of half truths. Don't freak yourself out. Go to the source, educate yourself. The reality is that most of us are going to be just fine. Okay, so what is the coronavirus? Well, the coronavirus, proper term COVID-19, and for the sake of clarity, we're just going to refer to it as COVID-19 because there are a number of different viruses within the coronavirus family. COVID-19, it's new. It's never been seen in humans before, so there's no vaccine as of yet, and none of us have an immunity to it. So with a new virus, there are a lot of unknowns about, a mortality rate, who impacts, things like that. And we're starting to see that it is highly communicable. It's easily transmitted throughout communities, and it's having an unusually heavy impact on those that are 65 and older and those with underlying health conditions. Now the coronavirus, or COVID-19, it affects the respiratory system, and also in severe cases can cause organ failure. So the symptoms: dry cough, some fatigue, shortness of breath, and a mild fever, right? It's March, cold and flu season. Pretty much everything going around causes at least one of those symptoms, so it can be a bit confusing. And the way that COVID-19 is transmitted is through respiratory droplets. Now, what are those? Whenever you cough or sneeze, you release some droplets from your lungs, from your throat, into the atmosphere. Those are respiratory droplets. They contain the virus. You infect another person. When that person inhales those droplets and it comes into your lungs, your nose, your mouth, or potentially we can also contract it through the eyes. As of recording, that hasn't been confirmed, but it's believed that could be a vector of transmission. So if you get any of those respiratory droplets in your eyes, potentially it could cause infection as well. Now, speaking of respiratory droplets and coming through, when the virus first started gaining notoriety, there was a graphic from the Center for Disease Control that had a bunch of different faces wearing face masks and respirators, and news outlets were saying, oh, CDC recommends that guys with beards shave so they can wear a respirator properly. The reality is that graphic was not released in response to COVID-19. It was released in November of 2017, and we all know what happens in November, right? Movember, No Shave November. So the CDC put together that fun graphic kind of in conjunction with those two events. And it's intended for people that actually wear respirators on a daily basis. And if you are one of those people, you know the SOPs. You have the standard operating procedures about how to properly wear that equipment, how to maintain it, how to don and clear, if you will, and how to remove it, right? So that graphic wasn't intended for you or I. As a matter of fact, the CDC and the WHO recommends that those of us that are healthy, we don't need to be wearing masks. The only people that need to be wearing masks are those that are working with potentially infected patients, and also those that are caring for loved ones that are infected or could potentially be infected. Now, some of you might be like, well, Nick, you know what? I'm paranoid and I'm going to wear my mask. Okay, bottom line, if you have facial hair, you put on a respirator, it's not going to work. The way those respirators work, form a seal around your mouth. When you inhale, all the oxygen coming in through your lungs have to go through that filtration system, filtering out any harmful bacteria, viruses such as COVID-19. Good to go. If you just put a mask on and you're walking around and you have facial hair or it's not properly fitted, you're not going to have that seal, and it's not going to do you much good. Now, if you are sick, this is also when the CDC recommends that you should wear a mask. Why? Because respiratory droplets, right? You cough, you have a mask on, it's going to help contain those droplets so it's not spreading an aerosol around the environment around you. So if you are sick, you should be wearing a mask to help contain that. But there's no need for us to be hoarding masks or to be walking around sporting masks, because the real reason is you need to know what you're doing. And like I said earlier, if it's not properly fit, and we're not going to go into that, but I linked down below to the World Health Organization. They have a video that explains how to properly fit some of those respirators. And also, when you're done, how to properly remove your respirator, right? Because think about it. So this is spread through respiratory droplets. You're going about your day. Maybe you walk through a cloud that contains, the virus. You get home, you take off your mask improperly. What's happened? You've touched your mask, you've contaminated your fingers. Now you might contaminate yourself. So there's specific steps you need to take to properly remove that mask and to dispose of that mask. We don't reuse those types of masks. And again, that information is linked down below. Now, what can us bearded guys do? Well, the big thing, right? Wash your hands for at least 20 seconds. This virus is spread through coming in contact with those respiratory droplets. Those droplets settle on surfaces. We touch those surfaces, then we touch our face, we touch our eyes, we touch our nose, what have you. We ingest the virus and we become ill potentially. Now, guys with facial hair, right? I don't know about you, but I'm constantly stroking my beard. And now I've become really aware of that because what happens? I touch something, stroke my beard, get home, wash my hands, good to go, things great, stroke my beard again, eat dinner, boom, what's happened? Potentially could have infected myself, right? So we need to be aware of how often we touch and play with our beard. Now, along those lines, we normally advise men to wash, their beard once or twice a week or as needed. But I am washing my beard every day, and that's just an extra safety precaution, just like your skin, walking around the environment. Should I come in contact with someone or, some contaminated particles that could settle on my beard. So just like I'm constantly washing my hands, I'm washing my beard to rinse that out. But to reiterate, those that are most at risk for this virus are the elderly and those with underlying health conditions. The average person, you and I, we're going to be fine. Some people are stockpiling toilet paper. I don't understand it, but cool. Hey man, whatever floats your boat. But the reality is practice good hygiene. Wash your hands, disinfect surfaces you come in contact with. Be really careful about stroking your beard and make sure you're washing your beard at least once a day. I normally do mine at the end of the day before I go to bed, so when I wake up in the morning, I start fresh. If you found some value in this video, go ahead and smash the like button. If you have any questions, comments, corrections, go ahead and drop them below, and we'll see you on the next one.